Hi, everyone. I've been asked to speak on the topic of achieving healthier populations based mainly on the findings of a forthcoming book on promoting the health of older adults, for which I'm the lead editor. The manuscript has been accepted for publication, was accepted for publication just before COVID-19 struck in Canada, but we were able to add a chapter and additional information on the impact of the pandemic, which could also be called a Jerry pandemic, considering the devastating effects on older adults. Most of the authors were academics from a wide range of academic fields and are likely to be members of a variety of professional associations that would qualify as civil society organizations. Also, some of the non-academic authors were associated with other civil society organizations. I've been asked to answer the following two questions. First, what have we learned from COVID-19? And secondly, what needs to be done differently? To begin, we learned that the highest death rates from COVID-19 were among older adults, especially those in congregate living environments. In general, older adults experience more stress, social isolation, and barriers to meeting day-to-day needs, and many of their health and social problems have been exacerbated. Some groups of older adults are particularly vulnerable. These included people with pre-existing conditions, those with mental health challenges or with limited resources, visible minorities, those living in rural or remote areas, on reserves, and homeless people. We learned that long-term and community care were particularly problematic for older adults. In long-term care, COVID-19 exposed long-standing systemic problems such as underfunding, staffing shortages, training and remuneration, organizational and design deficiencies, and fragmentation. Similar issues in the community care system across Canada were also problematic for older adults. Most importantly, the pandemic exacerbated ageist narratives and further diminished recognition of the human rights of older people. Finally, we learned that our knowledge to deal with the pandemic was insufficient. Research and detailed data lagged behind the disease. For example, we still knew little about the long-term consequences for those that recover and the broader social implications for population aging and health. This is not an exhaustive list of the things that we didn't know before the pandemic, but it gives you a sense of how unprepared we were for it, particularly for older adults. We also need to acknowledge that the pandemic had some positive impacts. For instance, the systemic human rights violations in Canada witnessed in the pandemic have reinvigorated activism and revealed yet again the need to address ageism. Given what we learned and what we know about health promotion, I come to the second question of what needs to be done differently to promote the health of older adults. I will address the question using the 5 action areas in the Ottawa Charter, which we used as the framework for the book. With regard to the first area, building healthy public policies, thanks to outrage and effective advocacy by professionals, organizations, and the public, the federal and provincial governments in Canada have already started to develop new policies for long-term care. They've implemented policies for testing and treating pandemic cases, as well as for stronger surveillance systems. We also need to adopt a rights-based approach to policies and a more positive view of aging, and reflect that in our work and lobbying efforts, there is also a need to improve collaboration between academia and civil society to lobby for healthy public policies. With regard to the second action area, creating supportive environments, we need to develop and implement innovative housing models, develop resources to prevent criminal victimization and mistreatment, and to invest in new age-related technologies. As for the third area, strengthening communities, we need to enable communities to take control of their own endeavors and destinies by encouraging and supporting participation, capacity building, and planning. We also need to facilitate and fund continuous access to reliable information and learning opportunities. We also need to provide support to do so effectively and support communities to promote social cohesion and social movements in neighborhoods. In addition, we also need to create opportunities to safely engage socially and to monitor community members' health and well-being, and enable individuals and communities to gain control over the determinants of health. And finally, to recognize and address the intersectionality of factors faced by vulnerable populations. With regard to the fourth area, developing personal skills, we need to support the development of health literacy and digital health literacy skills. Conduct more evaluation studies addressing concepts such as reablement, resilience, and lifelong learning, and provide more culturally sensitive training for caregivers and others that work with older adults. Finally, in relation to the last area, reorienting health services, we need to recognize and support the important and expanding role of family caregivers, including in long-term care. We also need to identify the challenges posed by bringing together interdisciplinary groups to ensure a vibrant and exciting process of prevention and care, and innovative thinking and practices so urgently needed in nursing homes and other settings. We also need to look for lessons from across Canada and other countries and describe interventions under investigation using terminology that has consistent meaning across countries. And finally, we need to talk more about death and dignified dying as part of the life course, and introduce policies, legislation, and practices that enable palliative care and allow older people to make informed decisions about how they wish to die. These are some of the suggestions in the book that we think will help promote the health of older adults. In conclusion, we need to share our experience and knowledge, and we can learn a lot by collaborating with people and organizations in other fields of study and practice. I'd like to acknowledge and thank the authors of the chapters and reflection pieces in the book, especially Andrew Wister, who wrote the chapter on COVID-19 after the book had been accepted for publication, as well as my co-editors, Peggy Edwards, Fran Grunberg, and Melanie Levasseur for their significant contributions to the book. And I'd also like to thank all of you for attending this forum.
Hello, everyone. This presentation is titled Increasing Resilience Through NGOs, Together We Can. Civil society has a crucial role to play in ensuring health promotion. I'm thankful to the opportunity to share our community experiences from Bangalore. Resilience is not just a single skill. A variety of skills and coping mechanisms pumped into communities is what makes them stronger and allows adaptation and growth of communities. We have included women and youth in our experiments because women and youth are the leaders of today. The power of connecting, empowering communities, including youth and women. Extend your reach to the unreached. Enliven and connect communities, NGOs, governments, and policymakers. Enhance and sustained projects ensure narrowing of the socio-economic divide. Change is possible. Create newer opportunities, create and nurture local leadership, reach everyone, leave no one behind. Resilience is the gift of mankind. Together, we can enhance the power of resilience. Trip, fall, pick each other up and move on. Resilient communities can change the world. These are some of the experiments and that we have done in Bangalore to create resilient communities. This is about empowering women and creating women leaders. The first point is to create or recognize local women leaders who will then delegate the task and make resilience get into the society. Here you have an experiment where we got 100 women entrepreneurs to become successful. Otherwise, they were dependent on their alcoholic husbands and their socioeconomic status was very low. The experiment, which enabled them to become successful micro entrepreneurs, have increased the efficiency of running their families, and the children have been able to go to school. Women feel self-confident. Many times NGOs face fund crunch because they do not have support from other areas, so they have to raise their own funds. These are some of the innovative ways in which we created funds. You will find here the Honorary Consul General of Canada in India, Nicole Girard, who is inaugurating an art exhibition and sale. Top artists from the country sell their paintings here and give us the amount to support schools or literacy. Here again, you will find a young boy inspired by this exhibition, created his own art piece, sold it, and the funds were given for the benefit of children from underprivileged schools. During the COVID lockdown, we found the necessity to reach out to communities and children and hence supplied groceries and nutrition for school children and their families, which lasted them the entire period of lockdown. The stray animals were also affected during lockdown because they went hungry, and we provided an ambulance and food for them, where these animals were also fed and kept healthy. Building schools and promoting education is one of our primary jobs, where we talk of community resilience, because education is the key to all adversities, to face all adversities. It strengthens children and youth to face more challenges in life. This we build with the help of our international partners. Roadside Australia, you will find Mr. Wolfgang Paul, who was here in India to inaugurate the school. So we get the support of international partners and build schools in remote areas where otherwise education is impossible, because children have to walk. They don't even have roads to traverse or walk, and therefore we provide these schools in their neighborhood so children are educated. Supplementing nutrition for children. Milk and eggs are supplied along with their midday meals, which are free for children, so they are not denied nutrition at the stage in which they need the correct growth and development. This is the setup of an occupational therapy center at the Home of Hope for the Destitute, thereby making life meaningful for these people who are otherwise languishing on the streets. They are the most rejected in society, and by giving them an occupational therapy center and a place to reside, we have made their lives meaningful. Providing shelter during natural disasters. Many times government cannot reach out to every single individual, and NGOs step in here. So civil society support is very essential, especially in natural disasters. This is a picture of the Amphan cyclone, which hit recently Orissa and West Bengal in India. And these are shelter kits which have 52 essential items, which will last them until help reaches them from the government or from other sources. Polio immunization drive. We were able to drive out polio from this country only because of the help of civil society and youngsters and others who supported us. Rotary has a major role to play in eradicating polio from India. Environment conservation. We also support the conservation of environment. We dig up recharge wells and conserve groundwater. And you find here, this is the revival of the Chalahalli Lake. We are using a material called the geotextile, which protects the bund from eroding, and water fills up during rains, thereby bringing joy to the communities around the village. This is promoting menstrual hygiene, where we provide sanitary napkin dispensers and incinerators to girls in schools and colleges, thereby making them self-confident and allowing them to come to school regularly, not missing their classes. This is promoting physical activity in children, where children are otherwise not having the opportunity for sports at all. So we allow them to have annual events where we are able to actually recognize a lot of hidden talents. This was a swimming competition for disabled children. And therefore here we recognize a lot of talents which later go on to become national and international champions. Blood was scarce during the COVID lockdown, and our blood donation drive helped us to provide blood for the people who actually need them, like thalassemia patients who were on regular blood. And the supply of blood was hindered greatly. Therefore, we went around requesting people to donate blood, taking all precautions during the COVID lockdown period, and collected sufficient blood to reach out to these people. Whatever the mind of man can conceive and believe, it can actually achieve, said Napoleon Hill. Resilience can overcome every adversity. Thank you. Merci.
Hello everyone, my name is Veronica Shiroya from Kenya.
And I'm Benjamin Masila from Kenya.
Today we are going to present to you the Kenyan experience during the COVID-19 pandemic, with describing the role of environmental and public health officers during this period. And to start out, we look at the current COVID-19 numbers, which are currently, as at 18th October, stand at almost 45,000 reported cases and up to 825 deaths, even as we move into the second wave of the pandemic. The impact of COVID-19 in Kenya has been that up to 90% of Kenyans have reported loss of income and livelihood since May 2020, when the pandemic, during the early periods of the pandemic. There have also been high rates of teenage pregnancies due to school closures, and increased cases of gender-based violence, with 7 in 10 Kenyans reporting that they've experienced domestic conflicts of violent and physical nature. Lack of access to sanitation and menstrual health products have meant that the youth who receive these programs through the school systems have been affected, and inadequate access to safe, clean water is another challenge, and heightened social stresses have led to increased crime rates, missing children, alcohol and substance abuse, and other mental health issues. There's increased environmental degradation, including the ill disposal of used masks and other hygiene products, and unfavorable pandemic work conditions for health workers, including public health officers and environmental health officers who operate in non-clinic settings, have left them vulnerable and neglected. The COVID measures enforced in Kenya have mostly adhered to the standard guidelines globally, which have focused on some behavior change approaches like hand washing and physical distancing, among others, but there have been missteps, predominantly the top-down approaches through internal security measures that are focused on internal security first rather than public health first, and left the enforcement to police and law enforcement rather than public health officers who are trained to implement behavior change, communication, and strategies in a public health responsive manner. The initial heavy focus on clinical management strategies have, at the expense of population prevention strategies to curb community spread, especially early on during the pandemic, have meant that so far it has not been effective to contain the contribution of young people in spreading the virus locally.
There have been emerging concerns with regard to community pandemic spread containment, including a general relaxed attitude towards the measures that are being enforced by the departments of health, the reopening of social places like bars, also reopening of schools, which are in their second week, where families, community members are feeling that physical distancing measures will not be fully enforceable and therefore will expose them to greater risk. There is continued general suspicion and mistrust towards the way government has handled the COVID-19 pandemic, with approval ratings continuing to dip among the community members. There is continued also stigmatization of suspected or recovering cases at the community. So when we look at community engagement for pandemic mitigation, it involves provision of accurate information, engaging the key community stakeholders who will help to counter the myths and the stigma. And there's also need to recognize the role of community members as being themselves key actors in pandemic mitigation. Utilization of contextualized two-way dialogue in how we engage the community, and also focus on low-level community representatives who are in direct touch with the community. The most vulnerable also need to be focused on, and there's also need to include sustainability considerations at the design stage of the interventions. So who are these environmental health officers or public health officers in terms of building resilience for improved health in communities? In Kenya, mainly they serve as community health extension workers who supervise community health volunteers at the preventive health care part of the health system setup. But to move from the response to the recovery and to resilience, there is need for a central role for communities, which translates to a central role for the EHOs and PHOs in Kenya. These PHOs, CHOs are qualified persons in the council-approved training at a Bachelor of Science level, and they enforce various health acts, and they are involved in formulation, implementation, interpretation of various public health policies. They support a cross-sectoral planning and implementing of promotive and preventive health programs, and also work as key first responders because they are the custodians of the community health strategy in Kenya. Two case studies for Nakuru County and Nzoia County is where you find intensified testing and risk communication, as well as home-based care interventions with regard to the second wave. And in Nakuru specifically, there's a joint initiative by the government and the NGOs for a co-created wash recovery and resilience program. In Nzoia, you find the Department of Public Health working with NGOs such as the Rotary Club and the Health Promotion Alliance of Kenya to train health care workers and to improve community health literacy. You find, however, gaps like need for sustainability considerations for programs, especially in Nakuru County, as well as low private partner support for the initiatives of the Public Health Department in Nzoia County.
And so to conclude, the key message from our presentation is that in Kenya, taking forward the empowerment message of health promotion requires a reconceptualization of the health promotion approaches locally, using culturally sensitive, contextualized and simplified strategies that would encourage ownership across the board. There's also the need to reorient the health system further to not only recognize the role of health promotion in pandemic preparedness and response, but also to be resiliently health promotive within itself. And the recognition and reaffirmation of the unique role of environmental health officers and public health officers as previously described, especially as stewards of health promotion and its application through their unique kind of training in both intersectoral within the health system and also multisectoral approaches and response to health emergencies at present and also in future. Thank you.
Thank you.
Bonjour. Alors, est-ce que les organisations non gouvernementales peuvent avoir un impact significatif en promotion de la santé? Oui, assurément, dans les milieux de travail notamment. On le retrouve d'ailleurs dans le contenu même de la Charte d'Ottawa pour la promotion de la santé, qui prescrit que la façon dont la société organise le travail doit être une source de santé pour la population. Et ici, au Québec, des entreprises de tout secteur d'activité s'inspirent de plus en plus de bonnes pratiques en matière de santé et de mieux-être. Il existe un référentiel important, de même qu'une démarche Entreprise en santé qui guide les employeurs dans ce sens, avec des mesures concernant les habitudes de vie, la conciliation travail-famille, les pratiques de gestion et l'environnement de travail au sens large. Et on en tire donc des bénéfices significatifs pour les entreprises, pour les employés et même pour l'ensemble de la société. En effet, par exemple, on constatera des améliorations dans les indicateurs de santé suivant une meilleure alimentation ou plus d'exercice que pratiquent les employés. Également, moins d'absentéisme, un climat positif qui se développe dans l'organisation, des relations de travail améliorées, de même qu'une fidélisation de la part du personnel, un personnel de plus en plus engagé. Également, la rentabilité qui s'améliore, de même qu'une saine productivité qui se développe, et des externalités même positives, puisque les employés sont également des leaders dans leur milieu de vie. Ce sont des personnes qui, comme parents, comme grands-parents ou comme personnes s'impliquant dans leur communauté, incarnent un modèle santé qui influence leur entourage. Donc, également des avantages pour l'ensemble de la société. Ce sont des pratiques dont s'inspirent de plus en plus d'organisations au Québec. La mobilisation est en cours. C'est une mobilisation qui origine justement d'un organisme non gouvernemental, le Groupe Entreprise en Santé. Et pour nous, il est important pour ce groupe-là de sensibiliser donc les employeurs aux meilleures pratiques, de les outiller, de les soutenir, de les reconnaître. Et nous avons développé tout un réseau de chercheurs, par exemple au niveau universitaire, la communauté Entreprise en santé que nous avons initiée, où on retrouve de plus en plus de personnes intéressées, des entreprises engagées qui deviennent membres du groupe Entreprise en santé, et également un tas de partenaires privés et publics, de même que des conseillers en santé et mieux-être qui nous épaulent dans tout ce travail de mobilisation. Et tout ceci pour avoir des entreprises proactives dans des démarches structurées et accessibles répondant aux meilleures pratiques. Et notamment la démarche Entreprise en santé, qui est d'ailleurs intégrée maintenant à une importante politique de prévention en santé du gouvernement du Québec et à son plan d'action gouvernemental qui en a découlé récemment. Maintenant, qu'en est-il dans le contexte de la pandémie? Eh bien, ce qu'on constate, c'est que les priorités maintenant des entreprises, depuis mars 2020, vont à s'adapter à cette nouvelle réalité en intégrant la santé comme priorité. C'est un effet d'éveil, un effet révélateur, notamment pour la santé psychologique. Alors, nos contributions dans le contexte actuel de la pandémie sont les suivantes. D'abord, on a intensifié nos activités en ligne, bien sûr, les webinaires thématiques, les formations, les accompagnateurs notamment, et les résultats nous apparaissent assez probants. Premièrement, nous rejoignons aujourd'hui 10 fois plus de personnes et d'organismes qu'en mars dernier. Les entreprises qui avaient déjà mis en place des démarches Entreprises en santé avant la crise, ce qu'on constate, c'est qu'elles ont su rebondir plus rapidement. Également, ce qu'on constate, c'est une augmentation de l'intérêt par rapport aux outils en santé mieux-être et aux démarches de type Entreprise en santé. En conclusion, oui, les organisations non gouvernementales peuvent avoir un impact significatif en promotion de la santé. Et il est rentable pour des employeurs, des organisations d'investir en prévention dans leur milieu. Prévention donc au niveau du personnel et non seulement dans une prévention au niveau des équipements ou des machines. On comprend bien. Ce que donc nos employeurs comprennent de plus en plus. Merci.
Good morning, good afternoon, good evening. My name is Jeni Miller. I'm the Executive Director of the Global Climate and Health Alliance, which is an alliance of health organizations WHO civil society partnerships, and specifically about the WHO Civil Society Working Group on Climate and Health. So the WHO Civil Society Working Group to Advance Action on Climate and Health was established in May of last year, which seems like an eternity ago now. And it was invited by WHO Director General Tedros. It consists of 13 leading health organizations that have all been active on the climate change issue and represents diverse geographies, different types of health professions, and different types of organizations. And the core purpose of creating this working group really was to formalize and strengthen collaboration between WHO and civil society on the issue of climate change, to really push for ambitious climate action to protect health. These are the working group members, the inaugural working group members. WHO and my own organization co-chair the working group. And about half of this group will rotate off each year and a new cohort will join. So in our first year, even though we were sort of getting ourselves off the ground, we had a number of accomplishments that I think we're quite proud of. One of the ones that I'll highlight that just really shows the collaboration, what's the potential of collaboration between WHO and civil society, is that by working together during the 2019 UN climate negotiations, we were actually able to put health into the media coverage of the UN climate negotiations. So there was substantial media coverage that referenced health and put health at the center of the conversation. So what have we been working on this year? As we all know, this year has been really dominated by the global pandemic. The health community has been on the front lines in a wide variety of ways. But the pandemic has also had economic consequences, and fairly quickly, governments began to look for ways to respond to those economic impacts. By early May, globally speaking, there had been government stimuluses of between 12 and 15 trillion US dollars invested to address the economic impacts. And yet of that, less than 0.2% were being invested in climate priorities. And indeed, fossil fuel companies and carbon intensive industries were actually at the table talking to decision makers to ask for bailouts, rollout of regulatory restrictions, and that sort of thing. So it's fair to say that the climate and health community, in spite of the fact that many were involved in pandemic response, was alarmed. So in response to this, coming out of the Civil Society Working Group, WHO Civil Society Working Group, we formulated a letter directed to the leaders of the G20 countries, calling for any investment of public COVID-19 recovery funds to be invested in ways that also support strong public health systems, clean air, clean water, and a stable climate, so that we're preventing the next health crisis and protecting a healthy future for everyone. The letter really resonated in the health community, and we were able to secure sign-on to the letter from organizations representing over 40 million health professionals globally. And just for context, that's somewhere between half to 2/3 of all health professionals in the world. That level of response and commitment generated news coverage worldwide. There were also multiple op-eds. There have been commentaries in medical journals. There's been direct advocacy in countries that built upon this letter. And our diplomatic sources have told us that about 2/3 of G20 leaders were actually swayed by this letter. In addition, alongside it, WHO released a Healthy Recovery Manifesto. And I think this really exemplifies that collaboration between civil society and WHO. So coming out of the Civil Society Working Group, we delivered a letter with demands to governments that came from civil society. And then alongside that, WHO released a manifesto that speaks to governments and how governments can actually take action on this. So what worked? There were a number of factors that made this Healthy Recovery Letter successful. I think the one I want to highlight here is it really depended on outreach via health networks, and the WHO Civil Society Working Group, members of that group really reached out via their networks, and GCHA and our members and partners reached out through our networks, and that's what really made the sign-on and the power of this take off. So what do we have coming up this year? There are a number of activities to continue to push the message that health needs to be at the center of climate action and that climate action is urgent, and that this needs to be integrated with our pandemic response. The things in bold are things that are part of the WHO Civil Society Working Group activities. So I want to leave you with 3 key messages. As the health community, we know we can't ignore underlying conditions when we're treating an acute condition. So we've got to keep addressing climate change in order to protect the planetary health upon which people's health depends. 2, we've got to urge our governments to align their climate action plans with the target and goals of the Paris Climate Agreement, and to put health at the center. And then finally, we've got to continue to demand an integrated response to the COVID pandemic that equitably addresses the pandemic itself, that strengthens our health systems, that invests in a stable climate, that brings a just economy, and that puts health leaders at the table when all of these decisions are being made. Thank you.
So it's my turn. Thanks to all the speakers. Today we're experiencing innovation with the introduction words at the end of the session. Technology can push us in a very unusual and unexpected way, believe it or not. So our session is about organizing civil society for impactful health promotion. I would like to share with you 2 short references based on civil society mechanism for universal health coverage 2013, recent observation. In April 2020, few weeks after the beginning of the pandemic, they conduct a worldwide survey about civil society participation in the COVID-19 response. They welcomed 200 replies from all around the world. The result is simply discouraging. In a few words, civil society is at the forefront of the COVID-19 pandemic, but their voice and the role of civil society organization do not necessarily benefit from relevant attention of government and public authority. In September 2020, so a few weeks before, the same source of information published a blog with little change. Let me quote it. Government cannot afford to wait until the end of their emergency response mode to engage with civil society and seek their leadership. Any delay in listening to community voice can backtrack progress made in universal access, result in more individuals experiencing poverty, worsen case rates for other disease, and continue to exclude marginalized community. End of quotation. It looked like Ottawa Charter, Alma Ata, and Astana Declaration and their strong emphasis on CSO role simply never existed. This is sad, very sad, and more than ever, we need to give maximum light to inspiring case, including co-design initiatives, and push government not only to consider seriously to work with CSO, but in a respectful manner. I also extend my comment at the international level, so it also concerns the Alliance for Health Promotion with the link with WHO. More than ever, it is time for a strong wake-up call. So I hope the presentation has been helpful to change this view. So it's time to welcome comment and question. Let me see if we have comment and question to our panelists. I don't see any question or comment up to now. I'm wondering if some of our panelists would like to comment one or the other presentation. So again, if one of our speakers would like to add some comment or observation, the floor is yours. Yes, Irv, please.
Yeah, I just wanted to make some comments in relation to the Ottawa Charter for Health Promotion and its usefulness today. As I mentioned in my presentation, we use that as a framework for organizing the book, and we had sections on each of the 5 areas of the Ottawa Charter. It worked very, very well, but there were some areas that need to be improved. And we, earlier this year, we had a visit from Don Nutbeam in Vancouver, and he did a presentation on what needs to be changed in the Ottawa Charter. And I thought maybe it would be helpful to people to know a couple of the suggestions that he made. What I'll do is go through the 5 areas and just pick out one suggestion so that you get a sense of where this is going. So with respect to healthy public policy, he suggested that we need to adapt it to make it relevant for the range of political and governance structures in different parts of the world, to reflect better the impact of more locally determined policy. So that's a good suggestion that he's made for enriching that healthy public policy part of the Ottawa Charter. Secondly, with regard to community action for health, he suggested building partnerships with civil society organizations who have a credible voice in their community and can deliver programs and services that governments find hard to deliver. With regard to promoting and further developing setting-based approaches, he suggested at their national and international level, we need to have more advocacy for action to address the major environmental threats to planetary health, which kind of endorses the last presentation. Developing personal skills, he suggested that we need to harness the potential of digital technologies by creating relevant, accessible, trustworthy sources and regulating to minimize harm. And then finally, with regard to reorienting health services, He noted that primary health care is a whole of society approach to health, centered on needs and preferences of individuals, families, and communities. It addresses the broader determinants of health and focuses on the comprehensive and interrelated aspects of physical, mental, and social health and well-being. And it also provides a whole person care for health needs throughout the lifespan. So that was what some of what Don was suggesting as a way of improving the Ottawa Charter. I hope that's helpful to the discussion.
Thank you, Irv. Jeni also asked for a comment, or I don't know. Please, Jeni.
Yeah, I think this is a question for a few of the panelists. So my focus is generally on the advocacy side of the equation of public health. It has been from the get-go. But I'm interested for a number of the presenters are coming more from the health, more traditionally speaking, health promotion side. And I'm curious, particularly the Kenyan speakers and the Indian speaker, about that link between health promotion and advocacy, and if you see those as actually being compatible and things that can happen together, or are those two separate functions in the health promotion space? The kind of on-the-ground health promotion with communities and the kind of advocacy that we need to do to create the conditions for good health.
Thank you, Jeni. So I don't know, Veronica or Elizabeth, if you would like to answer to this question. Yes, Elizabeth, please open your mic. Thank you.
Yeah, Jeni, thank you for that question. And I fully endorse the view that advocacy and community participation go together. So on the ground work and advocacy have to go side by side. It doesn't exist differently. And I always believe that boardroom discussions should reach grassroots. If it does not reach the grassroots and does not meet the community needs, then I don't think such meetings have anything at all in importance to giving it to communities. So therefore, our actions, our discussions should translate into actions.
Thank you, Elizabeth. Veronica, would you like to add something?
Yes, I'll just add that, yes, indeed, advocacy and the health promotion aspect do go together. They are linked. And especially in our communities where we tend to have certain structures that are, so to speak, have a hierarchy. So it often takes an advocacy approach to create some kind of ownership across the board. You'll find in these communities, people will listen to certain people more than others, and they'll listen to maybe opinion leaders more than a health promoter. So you have no choice but to work with everyone. And that's where the advocacy comes in, because you sort of have to engage everyone and also make sure that the messages that are coming out are palatable and are easy to be digested in these settings, and they are locally appropriate and locally culturally sensitive.
Thank you, Veronica. Now I give the floor to Roger, and then we also welcome a question from participants. So Roger, please.
Okay, I'm going to try to be as clear as possible in English, but I'm not sure. It's very important, if we want to have impact and be recognized as good partners from governments, to first of all base our actions on science and best practices. So working with universities and research centers and all that, and also we have to act or to develop the strongest network possible on a local, regional, national, and even international level, if we want to be heard and understand by our elected bodies, I would say. Referring to this last comment, it links with the presentation of Elizabeth, Veronica, and Benjamin as well, when they talk about the power of connectivity and the importance of community for action to succeed with strong action in promotion and prevention.
Thank you, Roger. Now I receive an open question to all of you, so feel comfortable to reply. What do you think the exact role civil society organization is to contribute to managing the pandemic that has been a stark gap in the role of government and the private sectors? Can you give some key example of the difference between government, private sector, and civil society role? So it's an open question. Yes, Elizabeth, please.
Yeah, I always believe that local leadership helps in reaching people more effectively than from the policymakers directly. So therefore, encouraging local leadership is very important. And we have seen in the course of looking after the people during the COVID pandemic that 30% is what 30% of the population is where the government reached, but 70% was managed by NGOs and civil society organizations. So I certainly believe that civil society organizations have a major role to play in reaching out to the population.
Roger, yes, please.
Yes, because we already have a strong networks, I would say, that are open to receive, qui sont sensibles aux besoins des communautés que nous desservons. Au groupe Entreprise en santé, ce sont les entreprises du Québec. On est déjà en contact avec eux et on connaît avec elles et on connaît, we know about their needs, so we're ready to react very rapidly in such a context, in the context of the pandemic. No problem about that. What is important is to be able to work with them with the full support of our government. That was our priority, which happened indeed. So our government, I would say, manage the overall portrait of the pandemic and how we can react about that. And he can count on us to have very positive actions on every people in organization, in enterprises that need responses, need solutions adapted to their own context.
Thank you, Roger. Jeni, please.
Yes, thank you. Excellent question. And I think my angle on it is to highlight the ways in which civil society has really called upon both governments and the private sector to broaden the lens in how they're thinking about responding to the pandemic. So there have been sort of calls for greater social justice and equity in the response, calls for ensuring a green recovery, investments in the health systems with a view to going forward. So all of these kinds of demands from civil society, I think government has responded by looking at what do we do about this crisis. And the private sector has also kind of responded with, well, primarily around the economic crisis, or in some cases responding to this crisis. I think it's really been the role of civil society to say, there's a bigger context for this, and we won't have a healthy, sustainable, and just recovery from this pandemic if we don't broaden that lens and take these other factors into account.
Yeah, Irv, please.
Yeah, Roger talked about the importance of academia, and I just want to note that in creating our book, we had people not only from health promotion, but from gerontology, social work, and a whole range of other academic practices, academic practices and whatever. But it was very useful, and these people from the various academic fields were able to bring together their thinking in relation to health promotion. And so I think we need to try and work with all of the academic fields that are even remotely related to health promotion. And I also think that we need to, academia needs to build relationships with civil society. I don't see much of that happening yet. And in fact, I'm a victim of not doing it myself, but I'm starting to realize how important civil society is. And I think that we have a lot to contribute.
Thank you. By the way, in different places of the world, we have this kind of collaboration between academic and field organization, where each other try to understand what they do and how they can help the organization to take a better place and play a better role. But again, as I explained in my introduction word, the situation is still the same. We need a better recognition from a public authority, and it's not only a question of personal feeling, it's based on a survey. So we need to find, inspiration and I would say good case study where we can explain that, look, it can work if we have this better recognition. Yes, Veronica, please, open your mic.
Yeah, I just wanted to answer the question on the key examples of differences between government, private sector, and CSO role, and giving the example of Kenya, where in most communities, government is seen as this abstract entity which people can't really put a face to other than maybe their politician or the president or something like that. So that connection, direct connection is not there. But as opposed to civil society who are there in the communities working every day, and so finding more relatability in their approach. And so you can see the stark differences in how the responses are done, where government and private sector would be more focused on their outcomes, as Jeni said, but civil society will look more at the process, and they'll look at a rights-based approach, a human rights-based approach to addressing the pandemic. So that's why it's easy for government to say, deploy law enforcement to go and get people to act right, while civil society will say, no, we need to focus more on behavior change and communicating better and advocating better. And so just having some human sense to it. And so for me, that's what I feel the difference is, and that's why civil society is very important.
So we still have 2 minutes. I don't know if any speaker would like to make final comments or remarks.
Perhaps Benjamin has something to say.
Yes, Benjamin, please open your mic. Benjamin, open your mic. Your mic still.
Okay, sorry.
Yeah,
so
only 1 minute, please.
Okay. So for most of the experiences that we have seen in Kenya, the civil society is still doing most of the health promotion work. So government is really, for the past maybe a decade over, focusing more on the curative aspects of healthcare, and most of the health promotion agenda of the country is really run by the civil society. So there's still a huge opportunity for harmonizing our approaches between the government and the civil societies, because you will find that the approach to community health volunteers, the approach to water and sanitation, the approach to school health is usually more of the strategies that the civil society comes up with, depending on their funding organization, depending on what a university wants to follow or establish. That there's still a huge opportunity for us to see how we can harmonize our approach and strengthen, because at the end of the day, the community we are serving is just one. Thank you.
Thank you, Benjamin. So we're getting very close to the end of this session. I would like to take time to thank all of you for the preparation, the presentation. It's something new to discover using this technology. It's something new for me to discover, to make introduction note at the end of a session. We never know what we can experience. So I hope it has been very useful for the participant. And again, keep safe. Thank you very much.
Thank you.